Welcome to the Clean Classrooms for Carolina Kids Lead and Water Section Training. This program is a partnership between RTI International and the North Carolina Department of Health and Human Services, along with the North Carolina Department of Public Instruction as a liaison. My name is Martina, a technical support staff for the program. This training will overview the history of lead and water and give you an in-depth look at the lead and water section of this program. First, we will start with a background and the history of lead and water. Lead is a metal that has been used in a variety of products, including paint, gasoline, water piping, plumbing, and solder. Beginning in the 1970s, lead concentrations in air, dust, and soil began to decline in the United States, largely from phasing out lead as a gasoline additive and restricting the lead content in paint. However, lead hazards in water and in the paint of older buildings remain today. Lead is used in water infrastructure, including piping, plumbing, fixtures, and solder, with increasing restrictions over time. As lead has been used in water infrastructure, it is possible to be exposed to it at the tap. Exposure to lead is a public health concern, especially for children. There is no safe level of lead exposure. Health effects are irreversible, lifelong, and cumulative as exposure continues. These may include issues with hearing, speech, the brain and central nervous system, growth, and development. Learning and behavior issues include lower IQ, decreased ability to pay attention, and underperformance in school. Lead in tap water is not typically found at the source or water treatment plant. It usually gets into water on the way to your tap from its presence in distribution piping and household plumbing, including fixtures. Water chemistry and use can also affect whether there is lead at the tap. If your building is served by a well, the well components can also be a source of lead. Federal efforts to reduce lead in drinking water are ongoing. These include restrictions on lead use in water infrastructure, health goals, and testing requirements. Initial infrastructure restrictions on lead went into effect in 1988, with 8% or less of lead in piping and plumbing and 0.2% in solder considered lead-free. Since 2014, lead-free water infrastructure is defined as 0.25% lead or below. In 1990, lead-lined water fountains were also banned in schools. Regarding health goals, the EPA issued a maximum contaminant level goal of 0 parts per billion lead in 1991. They also set a treatment-based action level for public water systems of 15 parts per billion. There is still no federal enforceable health standard at the tap. In 2016, the American Academy of Pediatrics recommended that levels be below 1 parts per billion in drinking water to protect children's health. Recently, the EPA approved revisions to the lead and copper rule requiring utilities to test schools and centers in the future. However, this testing is limited to only 5 taps per building in schools and 2 taps per building in childcare facilities, whereas our program allows testing for all drinking and cooking taps. In North Carolina, there are also state-level requirements to address lead at the tap for childcare centers and public schools. The rules require facilities to 1. Test for lead in drinking, and 2. Mitigate taps with lead at or above the state action level. Water mitigation is included in the program for fixture replacement and filter installation. As this is a legislatively mandated effort to address lead hazards in drinking and cooking water at public schools and childcare centers, North Carolina facilities are required by law to make sure all requirements are met. The Clean Classrooms for Carolina Kids program is an expansion of the Clean Water for Carolina Kids program. Since July of 2020, we've worked with childcare centers and family childcare homes to identify and eliminate lead in drinking and cooking water throughout North Carolina. To date, we have enrolled over 4,700 childcare facilities and tested over 25,000 samples. Detectable lead was found in 92% of facilities and was above the state action level in at least 1 tap at 12% of childcare facilities. We also noticed significant variation in lead tap to tap within the same building. This means that within a facility, only 1 or 2 faucets or fountains had an issue, while the others didn't. Across the state, 3 and 100 water fountains and 4 and 100 kitchen sinks exceeded the state action level in our initial statewide testing for centers. We also found that detectable lead was common, with 1 in 5 water fountains and 1 in 3 kitchen sinks containing at least some lead. Overall, factors associated with lead in water included using well water, pre-1988 buildings, and Head Start programs. Having 1 or more of these characteristics made it more likely that at least 1 tap would exceed the state action level for lead. Our program presents a timely opportunity to allow schools and childcare facilities to test for lead hazards while also educating children and families about lead and water, how it gets there, what we can do about it, through multiple disciplines. Now we'll get started with an overview of the lead and water section for the Clean Classrooms for Carolina Kids program. So let's talk more about the who, what, when, why, where, and how aspects of our participatory approach. First, who should enroll your facility? It's helpful if it's a staff member familiar with using a computer, knowing the facility's layout and taps, as well as the water usage patterns. This should also be the staff member who will collect and ship the samples. Next, what information is needed? The enrollment survey will ask questions about building characteristics, student demographics, drinking and cooking tap names and locations, the number of other taps in the facility, taps with water filters, the tap name and filter type, and lastly, the drinking water supply. During enrollment, you will enter information about each tap used for drinking and cooking. We gather information by zone of the building, so when collecting samples, you can work floor to floor. Start with the ground floor so that when sampling, you avoid running water through the building before sampling other floors. Please use location and name fields to carefully describe the location of the taps. This will help program staff and EHS to accurately find the tap if mitigation is needed. Everyone involved in sampling should watch the demonstration videos in our training and resources page, as well as read the instructions. Next, when should you collect water samples? Water should only be collected when water has not been used for 8 to 72 hours, which means early in the morning so you can finish sampling before any water has been used yet in the building, or over the weekend. For larger facilities, you can schedule several shorter sample collection events with sample kits if needed. Again, make sure you finish sampling before any water is used in the building. Why should you sample when water has not been used for 8 to 72 hours? The longer water sits in pipes, the more likely that it will contain lead at the tap. Our goal is to check for lead at the tap after a regular weekend or overnight period. Now, what, if any, lead is at the tap for that very first student who takes a sip? Since we're focused on protecting children's health, we are focused on this question. Want to sample when you have been closed for more than 72 hours? If so, you can follow our Sample When Closed guidance in our training and resources page. Next, where do you collect water samples? Well, the short answer is at every tap used for drinking or cooking. After you enroll and receive your sample kit, follow the order listed on the chain of custody, the COC, document provided in each sample box. If a tap is broken when you plant a sample, write a note in the COC and do not collect the sample. Lastly, how do you prepare for water sampling? Make sure to designate one or more person to complete online enrollment and oversee sampling. You should also prepare to collect water samples by making sure any other support staff watch all training videos, setting a calendar alert for the date and time, and reading instructions. We recommend that you notify your community, including staff, students, and parents, about your sample plan before your sample collection date, and make sure they are aware of your participation, and also do not use water in the building during that time frame. And of course, it is important to properly collect samples at each drinking and cooking tap using the EPA 3Ts method, which we will review in a bit. Next, we'll walk you through some valuable resources designed to guide you through the program successfully. Once you're ready to begin enrollment, the program has several resources and tips to assist you with completing enrollment. One of the most important things for enrollment is designating taps to sample for our program. This process affects the rest of your participation and can cause the most effort later if taps are improperly sampled. Follow these resources for guidance on designating taps for drinking and cooking at your facility. As part of your enrollment, we ask you to check if your facility has a lead service line, as these were historically used to connect water mains in some buildings. Follow these resources for guidance on how to check for lead service lines before completing your enrollment. You can watch our How to Check for Lead and Galvanized Steel Service Lines video on our training resources page, as well as reference our informational flyer. Be sure to name your taps so that students, staff, or visitors can locate each tap correctly. During enrollment, you will enter information about each tap used for drinking and cooking. We gather information by zone of the building so it is easier to collect samples. Once you complete the enrollment survey and receive your sample kit, you'll be provided one bottle for each drinking and cooking water tap. That bottle will have a barcode and number that matches the COC, buildings, floors, and zones. Once you complete enrollment and receive your sampling kit, you're ready to collect your water samples. In addition to the sampling instructions found in your sampling kit, the program has several resources and tips to assist you with sample collection. If your facility is closed due to holidays, summer, and any other breaks that are longer than 3 days, we recommend that you flush your facility to ensure accurate results. Follow these resources for guidance on how to flush your closed facility before testing. You can watch our How to Check for Lead and Galvanized Steel Service Lines video on our training resources page, as well as reference our informational flyer. If you have ice makers, kitchen kettles, and other untraditional taps, the program has developed additional guidance which you can access here on sampling some of these untraditional taps. After you complete sampling, you will return your sampling kits to RTI Laboratory for analysis. Once your results are ready, you will receive an email notification that they are available to view in your portal. They will also be posted online at the Facility Data Mapper after 5 business days to meet communication requirements for your facility's community, while also giving you a chance to turn off any taps if there are taps at or above the state action level. The program will provide recommendations based on the levels of lead detected at each tap. Because there is no safe level of lead exposure for children, we recommend taking proactive, no-cost measures for all drinking and cooking water to practice clean water habits. For taps with lead concentrations above 1 parts per billion, we recommend low-cost risk mitigation measures. For taps with lead concentrations greater than 5 parts per billion, we strongly recommend taking low-cost risk mitigation measures. For taps above the state action level of 10 parts per billion, you should stop water use immediately and post a do not use sign at this tap. The program will reach out to you to help provide mitigation support. Follow-up sampling is required for taps with lead at or above 150 parts per billion because filters are not certified to remove lead above this level, and we want to better understand the source of this lead. The follow-up sampling kits will contain 2 sample bottles for each tap, along with sampling instructions and a chain of custody document. The 2 bottles will be used to collect a first draw sample and a 30-second flush sample, which helps identify if the source of lead is close to the tap, like the faucet or nearby plumbing components, or far away in other parts of your building's plumbing system. Our resource page have additional guidance if you need to conduct this follow-up sampling. Follow these resources here for guidance on understanding your results and recommendations to address any lead detected. For any tap at or above the state action level, you are required to restrict use to prevent drinking and cooking. We recommend that you print and post signs that the program provides and communicate your findings to your community. But you can find helpful resources in our communication toolkit. Required water mitigation will occur for taps exceeding the state action level of 10 parts per billion. This may include replacing faucet fixtures, water fountains, or installing lead-certified water filters. You can choose whether to receive materials only and use your own facilities or plumbing staff, or whether you would like to use our program team to complete on-site mitigation. The program will follow up with additional guidance. If your facility has a tap that requires risk mitigation, we will send a pre-mitigation survey to collect important information needed to coordinate your facility's mitigation. Follow these resources for guidance on how to complete the pre-mitigation survey and other mitigation resources. After mitigation is complete, a local or regional environmental health specialist will contact you to schedule a visit. They will collect samples at your mitigated tap to make sure the mitigation is effective. If post-mitigation results is above 10 parts per billion, alternate taps or water supplies will be needed. The tap results can be shared with your utility and the NC Department of Environmental Quality to consider additional funding support. Communication is a critical element throughout the participation process. You have an obligation to communicate plans, results, and actions to your school or center community. We are available to support you in this and have developed materials and language for you to share with your community if needed. We recommend that you communicate with your community throughout your facility's participation in the program. This includes informing families and staff before completing sampling and sharing results and mitigation plans. We offer a toolkit full of material that can be used to communicate with your facility's community to keep students, parents, and staff informed of your facility's participation in the Clean Classrooms for Carolina Kids program. Communication before, during, and after the process will help increase community engagement and build trust in the schools and facilities commitment to provide a safe environment for students and staff. All facility results will be available on the online facility data mapper 5 business days after results are directly provided to facilities. This allows facilities time to restrict tap use as needed and start the mitigation process, while also making it easy for facilities to communicate results to the staff, parents, and students. The program results summary is also updated in real time online and shows facilities enrollment, completion, and corresponding results. We would like to thank you for viewing and thank you for taking steps to reduce childhood lead and asbestos exposure. If you have any questions, please contact our team at www.cleanwaterforuskids.org/Carolina, or you can call and text at 1-888-997-9290. Thank you.